Hello, I'm Dr. Dennis McKenna, as always joined by Dr. Fred Venditti, our Hospital System General Director. Today is Tuesday, July 14th, giving you the update from Albany Medical Center. Let's jump into the COVID numbers, and we'll begin by the numbers in the capital region. 8 counties. These are people admitted to the hospital in the 8 counties of the capital region. You can see in this graph a slight tick up over the last couple of days. We're currently at 32 admissions. We at one point were down as low as 23. So it's a number that's going up a little bit.
Increase, Dennis, a little increase.
And that trend continues. So let's jump in here to the medical center. Familiar with this graph, of course. Horizontal bar above that are admissions into the hospital, and below the bar are discharges. Last week we were starting to say that we had more days with discharges than admissions. Actually, over the last couple of days, that trend has now reversed, and we've had a couple of days with more admissions than discharges. So now let's go to the third graph, and this is the morning census of people in the hospital at Albany Medical Center with COVID-19. And the solid line are the people who are in the hospital. And Fred, at one point that number was almost down to 10. Now it's closer to 20. In fact, I think the number is 19 on the floor, 1 in the ICU, none on ventilators.
That's right, Dennis.
And so we're watching that carefully.
And the majority of them, 12 of them are actively
being treated.
That number had been down in the 7 to 8 range.
So one of the things that we've always said is the value in having access to the data is no surprises.
That's right.
We're going to watch this on a regular basis, and on Thursday we'll be able to see if that number continues to go up or if it's going back down again.
Dennis, I think my job is to worry about this.
Yes.
And so I do worry about this. I look at this just as you do every day.
Absolutely.
And track it.
Absolutely. And we're glad that you do. And let's talk about some activity inside the medical center as well. Congregate living, people who come from nursing homes, group homes. What's happening with that population, Fred?
So, Dennis, we continue to see that population grow. So I think today we have 73 congregate living folks in the house. Now, many of them are still acutely ill. Not all of them are waiting to go back to their facility. But 73, and I think today we started with 714 patients in the house. So about 10% of the population.
As the hospital director, would you say whether or not that is impacting our ability to move people through the hospital?
It definitely is.
Yeah.
Our length of stay is up a bit. And so, those patients that are waiting to turn negative, that are not in need of our beds, it's absolutely affecting us.
All right. So we're going to watch it. I know we have a bunch of very smart people trying to help us with that issue as well.
Absolutely.
Let's talk about 2 more issues. I know today, Fred, you brought the incident command group back together. And
That's right.
So around that room was about 20 very smart people. And a couple topics came up. You and I both get a lot of emails, and people stop us in the hall and ask us about our policy about masks. And I think we wanted to address that again today. I know we've talked about it many times, but let's talk about it every day if we have to.
So, Dennis, masks are incredibly important, and we do have a policy that says when you're in the corridor, when you're walking on the floors in a patient's room, pretty much everywhere in the medical center, you need to wear a mask. And we have had feedback that that's not always the case. So we talked about that today, this group you mentioned, the Incident Command Group. We're going to put a message out there. We're really going to reinforce that. Masks are mandatory. We want people to understand that. We want them to follow that policy.
One thing that happens sometimes is people might come into the medical center and they may be making their way to a station to get the mask, but they're walking down the hall without one. So a reminder to members of our workforce and to people coming into the hospital, just like you would be going to the store, you need to come into the hospital wearing a mask.
Bring your mask with you.
Bring your mask with you.
And for our employees, Dennis, we want them to use the masks we provide, the surgical masks or the procedure masks.
Right. So we know that masks are one part of the whole strategy to reduce the virus. There are other things as well. Social distancing, of course, washing your hands, not working sick. And another one that's specifically targeted to healthcare workers is the wearing of protective eye gear.
That's right.
Goggles or face shields. And there's a reason behind that, and it has to do with mucous membranes.
So those droplets that you can inhale can also get on the membranes in your eyes and then get you infected that way. So a shield that prevents those droplets from getting to your eyes is important when you're dealing with a patient that either has COVID or potentially has COVID. So now that the rate of positive patients in the community is around 2%, we're going to institute in the next couple of days a policy where all of our employees with interaction with patients either wear a face shield or goggles or work behind a plexiglass shield, which also blocks those droplets.
So that sounds like a science-based decision where we look at the prevalence in testing going up, and so
Yes.
we say, let's, for our patient-facing people, put another layer of protection on.
That's right, Dennis.
Good.
The EPI group has divided the prevalence into 3 categories: less than 2%, 2 to 10%, and greater than 10%. And we're going to have different approaches in those categories.
All right, very good. So we'll watch that very carefully. And that, we think that's going to start in the next day or two.
In the next day or two, yes, there'll be some information that goes out, and we'll talk about it again on Thursday.
Good, good. I know down in the emergency department when I work, always wearing the goggles because, you take care of patients who come in.
They're unknowns.
Unknowns.
You don't know if they've been exposed or have the disease.
Right, very good. All right, let's change gears and let's focus on a clinical discipline within the medical center that we're very proud of. And we want to use this opportunity as often as we can to talk about things that are special or unique to the medical center. So I'm very lucky because, Fred, you're a cardiologist. So this is an area of absolute expertise for you. Let's talk about something called structural heart. So, Fred, first of all, what does it mean, a structural heart program?
So Dennis, structural heart is an approach to fixing defects in the heart non-invasively or less invasively than we would normally do them. So it's a discipline that's been in existence for about 10 years, and we started doing it in 2011, so pretty early on. The medical center has a lot of firsts when it comes to heart disease and taking care of the people's hearts. So first cardiac catheterization, first open heart procedure, first pediatric heart procedure, first intervention. So this is another category where the medical center has firsts.
And I think we've been doing structural heart since about 2011, so almost a decade of that. And there are many, but let's just say 3 main sort of structural heart procedures that we want to highlight, right? So TAVRs, MitraClips, and
Watchman procedure. So TAVR stands for transcatheter aortic valve replacement. And so through the artery in your leg, a new heart valve is put in if your valve is narrow. And so instead of having open heart surgery with a sternotomy, where the chest has to be opened, which is pretty invasive, it can be done through a blood vessel in your leg. Mitral valve clips, if you have a leaky mitral valve, it can be tightened up with these clips. Same thing, through a blood vessel in your leg. And then the Watchman is a device that prevents blood clots if you have atrial fibrillation and can't tolerate blood thinners.
And there are some people who can't because they're a fall risk or they have frequent bleeding. So this is a way for them to continue to have a fib but not have to take the blood thinners.
That's right, and not have a stroke.
Right.
So Dennis, this program, as you say, is almost a decade now. We've done over 3,000 structural heart procedures. So just a phenomenal program.
Are there some people that we should highlight and talk about the great work that they've done?
Absolutely. So Gus Delago, who's the director of the Cath Lab, really initiated the program. His partner, Brian Winston, member of Capital Cardiology. Mohammed El Hajar, one of the university or the Albany Medical Center employed cardiologists, has been very active from very early on. And Anthony Nappi, again, another one of the employed cardiologists here at the medical center. And then this is a team. There's actually a heart team. So the cardiologists, the vascular surgeons, the anesthesiologists, and the cardiac surgeons all get together and review these cases before they go. So the cardiac surgeon who's been pretty actively involved is C.T. Singh, one of our cardiac surgeons, and Dr. Reddy, one of our anesthesiologists, has spent a lot of time on the 7th floor doing these procedures.
So we obviously do a significant volume of cases, but I know this to be true. Our outcomes are also incredible.
So greater than 90% success in the TAVR world, which is pretty high from a mortality perspective, because these are still sick patients getting these procedures. We're in the bottom 10%, so the lowest 10% of all centers in the country from a mortality perspective, which is phenomenal. When it comes to Watchman, we're the second highest volume center in the country.
Wow. That's incredible.
Yeah.
And I know that we also rely very heavily on skilled nurses and CV techs who are up there working at the bedside with these doctors as well.
Absolutely. Very, very important. Very skilled people that support this program.
So I think, obviously our message to our workforce is this is an example of an area that we're very proud of, and our community, I think, should recognize the great work that's happening here and be proud of what we're doing.
Absolutely. Dennis, we pull people from Poughkeepsie, Syracuse, Burlington, Vermont, all over the place. It's a huge regional program that really takes care of a lot of sick people, makes it better.
And I know that we also work very closely with our affiliates as well, Columbia and Saratoga, as far as cases that they identify that might also benefit from the structural heart.
And with our new affiliate, Glens Falls Hospital.
Very good. All right, well, very good. So we're proud to recognize the Structural Heart Program, and I join Fred in thanking all the people who are part of that. And we would hope on a going forward basis we can continue to talk about great programs like this here.
Absolutely.
So if you want your program identified, let us know.
Yeah,
and we'll talk about
give us some statistics,
Yes.
tell us what you're doing.
Yeah, we know, but we think they'll reach out to us as
That's
well.
right.
All
We
right,
want to
very
hear
good.
from the horse's mouth.
All right, so we'll be back again Thursday. We're going to watch those numbers very carefully.
Yes.
In the meantime, wear your masks. If you're patient-facing, wear your goggles, wash your hands.
Wash your hands.
And we'll do all those things, and we'll continue to watch the numbers carefully. We'll be back again Thursday. We ask that you please take care of yourself, take care of each other, and we'll see you in 2 days.